Yes, two reports have gone out over the last few days at the same time. One in two very prestigious journals, one in The Lancet, which is a British publication, and the other in the New England Journal of Medicine. The New England Journal is data which has been taken by Kupat Cholim Clalit, the major healthcare provider, and the other one from the Sheba Medical Center, which is the largest hospital in the center of the country. And what both of them say is that if you receive immunization, there is a very great reduction, a substantial reduction, in the number of people who develop the disease. Okay, in the Sheba study by Sharon Amit and her co-workers, the numbers went down from 7.5 per 100,000 per 10,000 before immunization, to 5.5 a week later, to 3.5 2 weeks later, and even lower after the second dose. In the Kupat Cholim study, the figures were very similar, showing round about 92-95% efficiency rate in reducing the disease.
So we're seeing that's really massive reductions in symptomatic disease among people who are vaccinated. So why really is it necessary to have this Green Pass program if so many of the people are vaccinated that are preventing some of the non-vaccinated, let's say, from entering malls and other areas?
Okay, because the vaccination that is being used at the moment is not a vaccination against the virus. It's a vaccination against the spike protein, the projections from the side of the virus which allow the virus to attach to cells and to get into the cells in order to replicate or multiply. So what the vaccinations do is that as you get into contact with the virus, it prevents the virus entering the cells. If they can't enter the cells, they can't multiply. And if they can't multiply, they don't cause the disease. Okay? But the vaccination doesn't kill the virus. In other words, even if you're vaccinated, you can still contact the virus and spread it. The spread is much, much less than it would ever be if you were not vaccinated. Of course, the viral load, the number of viruses, is so much less after vaccination. That was shown from another one of the laboratories in Israel. An emergency or urgent report went out about a month ago showing that in the month of December, when you started here in Israel to vaccinate the older age group above 60s, and at that time the 40 to 60 age group were not vaccinated at the very beginning, that's not the case now of course, that the viral load went right down in the over 60s, in other words, the people who had been immunized. Okay, that report is now being peer-reviewed, so it went out as an emergency report. It will later go out as a fully peer-reviewed article. That means everybody else of the same status will review the article to make sure that it was properly done. But it seems that it was, and the information is getting out at the moment, and it's coming from here in Israel. Now, the Green Pass you asked me about is because people who have been immunized or who have had the disease, they are going to spread much less viral load. Therefore, they don't need as many restrictions in order to prevent the large amount of virus which may be spread from non-immunized people before the disease symptoms become apparent. That's why there's going to be the Green Pass.